Well, there's a lot of unmet needs. We have ictal burden during attacks, but we also have inter-ictal burden in between attacks. And this applies to almost 50% of migraineurs, meaning patients are not free of symptoms in between attacks. First of all, you have to talk to the patients. You have to assess these unmet needs. Most patients don't dare to tell their doctors about inter-ictal symptoms and inter-ictal burden. So you have to pave the way in order to make it easy to the patient to tell his or her needs during the consultation. And how do you do that as a doctor? You use open-end questions. You use the ask, tell, ask, meaning ask, tell, repeat format of interview to the patients, and that helps you to assess the patient's needs, to establish a diagnosis and the treatment. Well, we know that the monoclonal antibodies, the drugs targeting CGRP or the calcitonin gene-related peptide receptor, help to improve these symptoms, the burden of migraine in between attacks. We know these drugs reduce migraine frequency, they improve quality of life, and now we know that they improve work and productivity in between attacks, and they ease the inter-ictal symptoms. I think the most important insight is that a lot of patients have these inter-ictal symptoms, that migraine unfortunately is still underdiagnosed and undertreated. But on the other hand, we have drugs that can improve the treatment of patients with migraine.